Welcome back to Midday Kentucky, everyone. Well, Georgetown Bariatrics and Metabolic Centre is on the forefront of providing metabolic surgery for the fighting of diseases of type 2 diabetes and obesity, everyone. And their surgical procedures, specifically the gastric sleeve and gastric bypass, are scientifically proven to improve diabetes, in addition to providing a surgical tool for weight loss. Joining me today to discuss the options of weight loss surgery is Dr. Eric Smith, and one of his amazing success stories is his patient, Chelsea Emmons. How are we, guys?
Doing good.
Good. Welcome to the show. Okay, everyone, I just have to tell you this. 172 pounds is what you have lost. I am so impressed.
Yes, thank you.
How do you feel?
I feel amazing. I feel like I've got my life back. I'm reborn.
Like, when you hear, look, I've got so many stories, but I want to say, Dr. Eric, when you see, and you've seen this before, being one of the best in the business, 172 pounds, gorgeous young woman has her life back. How do you feel as a surgeon?
Oh, we feel good about everything that we've provided for, but it takes a lot of work,
Yeah.
on her behalf too. So I think it's rewarding, but it's exciting to see them take the instruction that we've given
Yeah.
them and apply it.
And that's the important thing, following the instruction. What were your health concerns before the surgery?
Well, I've always been obese my whole entire life. I just tried every diet, struggled with everything, and I had high blood pressure, thyroid disease, diabetic, and just miserable overall, and just getting worse day by day.
Okay,
Yeah.
Why obese your whole life? Was it diet? Was it an issue mentally? What was the story?
Both, really,
Really?
mentally, and just failed and tried everything.
All right, let's talk about what procedure you decided to do.
So she had a sleeve gastrectomy,
Right.
which is the most common procedure that we do. We've talked about that many times on,
Yeah.
on this show, which is what we classify as a restrictive procedure.
Yeah.
Really just shrinks the size of the stomach, makes them feel full quicker.
Okay, so look, I have to show you all the before and after shots. They are absolutely amazing. When you look at these now, what do you say to yourself?
Like, oh, why didn't I do this 10 years ago? It's just unbelievable. My whole life has changed. Everything is new.
I can't believe it. Like, I love a before and after picture, people.
Yeah.
But this is absolutely amazing. How long since the surgery now, Dr. Smith?
She's just under 9 months out from surgery.
9 months, and you've lost 172
Yeah.
people. You've got to go and have it done.
Yeah.
Like, I'm serious. 9 months
Yeah.
and 172 pounds. Is that half your body weight? How heavy were you?
I was 348 pounds at my highest.
Oh my gosh.
I think when I saw her last in the office, we calculated the amount of excess body weight she had lost, which is really how we categorize this.
Yeah.
And she had lost, I believe it was over 85%.
Yeah, 89%.
Yeah, 89% of her excess
Amazing.
body weight.
Okay, I want to ask you a surgical question. Is there ever too much weight loss with this type of procedure? How do you gauge it as a surgeon?
Well, you can always lose too much weight.
Yes.
I do not see instances where the surgery creates too much weight loss.
Yes.
If we identify someone that's losing too much weight, it's a matter of nutrition. If someone doesn't have surgery and they don't take in enough nutrition, they can lose too much weight.
Yeah.
And so it's the same thing. Obviously, patients have battled obesity their entire life, and now they start seeing weight loss. You also have to be keen on, they're scared to gain it back, and maybe they're so afraid to eat enough food, because you have to eat to lose weight. You have to provide adequate nutrition to your body.
Course.
But it's not something where you can't stop it. Our bodies are gauged to be back near our ideal body weight, and taking the surgery and the tools that we give the patient to get there is really pretty straightforward.
I got you. Your greatest fear?
Probably be gaining my weight back.
Yeah.
But I'm determined. I'm not giving up. I've already made it this far. I feel like I could do anything.
I want to ask you a question, and it's not so much a testimonial, but there's women sitting at home, okay, and we've had Dr. Eric Smith on many times.
Yep.
And when you see this type of success story, what is your advice to the women and men sitting at home about contemplating this surgery?
Yes, I know surgery's not for everyone, and it just, it's really up to you, but I can't say enough about the Georgetown crew.
Yeah.
They're there from the beginning to the end, and don't wait any longer. Get your life back. I mean,
I think that's the
I got
perfect
my life
tagline.
back, yeah.
Get your life back. I think it's amazing. We appreciate you sharing your
Thank you.
story. I'd love to see you again. I think it's
you.
fantastic. Keep us in touch
Yes, I will.
with your journey as well. Dr. Eric Smith, thank you. If you want to find out more information about Georgetown Bariatrics and Advanced Surgical Services, there it all is up on the screen, everyone. Look, you know, the proof's in the pudding. You just saw the before and afters. You give them a buzz, everyone. Hey, after the break, everyone, here's more country music from the Avery Glen Crabtree Band. Take it away.